Hi, I'm Dr. Steve Myers, and I'm here with my patient Joycelyn, who is 3 months out from a bilateral knee stem cell procedure. Before we talk to her, we're going to take a quick look at her x-rays and see what kind of issues she was having on her x-rays. Okay, so taking a look at her x-rays, this is a standing x-ray of both of her knees. I have inverted the colors so that the x-rays look better on the video. This is her left knee, and if we zoom in on her left knee, you can see that she has a good amount of space between the bones on the outside of the joint. This is the amount of cartilage thickness in the joint. She should have the same amount of space on the inside, and she's lost a notable amount of the space. That loss of space is arthritis of the knee, indicating loss of cartilage. On her more symptomatic right knee, you can see that she's almost bone on bone. There is no space left between these two bones here, hardly any space at all. Severe arthritis with a big bone spur on the inside of the knee, large bone spurs on the outside of the knee. Bone spurs are part of arthritis as well. So thinking back to before your stem cell procedure 3 months ago, describe your symptoms. What kind of issues were you having with your knees?
Aching whenever I go for long walks. By the end of the walk, I'm limping, and I kept trying to do it because I enjoy going for walks with my husband. And I was taking Synvisc injections, and then I was told I can only have one a year, and I knew I had to do something else. My orthopedic doctor wanted to do knee replacement, and I talked to my family doctor and told her I wasn't ready for that. So she recommended Dr. Myers.
So before your procedure, how bad was your knee pain? Was it debilitating?
It was debilitating. I mean, there was a point where I was walking to work with a cane, and I only had to walk a block and a half from the parking garage.
Why ultimately did you decide to go with stem cell for your treatment option?
I had a surgery for a torn meniscus, and I knew I did not want another knee surgery. I've had a couple of friends who have had knee replacement, and they still have problems with their knee. And I just did not want to go that route. And I had heard about stem cell, and I knew that it was done in Europe because I've lived there before, and it was only considered experimental here. So after my family doctor recommended it, and I trust her, I thought I'd give it a try.
And the day of procedure, as far as doing the procedure, getting the cells, doing the injections, how much pain was there during the procedure itself?
Very minimal. It was great.
So here we are 3 months down the road, thinking back to before procedure, comparing your symptoms now. 10%, 50%, 80, 90, 100% better?
Oh, I would say 95% better. I mean, and it's not even quite 3 months.
And so are there activities that are easier for you to do now that you couldn't do before?
Anything. The walking is easier. Everything I do that's continued. Gardening is much easier. Getting down on my knees in the yard. Everything.
And you were recently painting your mom's house
Right.
or family member's
Yes,
house, up and down some ladders.
Up and down a ladder. I've never been able to do that without taking pain reliever first.
And this time around?
Nothing, just working.
No pain?
No pain at all.
With working on the ladders?
No, not at all.
Excellent. So having been through it, here we are almost 3 months down the road from your procedure. Do you feel like you made the right decision with your treatment?
Absolutely. I'm very excited about it. I can't wait to see the continual progress I'll make.
Very good. Well, thank you so much for coming in and sharing your experience.